if you have a patient that comes in and they're considering CBD oil, what is the information that you provide them with?
So right now there's just not a lot of evidence-based literature when it comes to CBD oil, whether it's beneficial or harmful to the patient. And CBD oil right now is not FDA approved or regulated. Yeah. So you may be getting different compounds from the stores that you seek. What I would recommend is that if you decide to use CBD oil for a myriad of different things, whether it be for pain, depression, anxiety, for sleep, that you discuss that with your provider to make sure that it's not interacting with any of your prescription medications. But right now there's just not a lot of literature to state whether it's harmful or beneficial to the patient, but you just want to talk with your provider to make sure that it's not interacting with any of your other medications.
And that advice is true of anything, correct? I mean, when we're talking about supplements in general, the more information you as a physician have, the better equipped you are to treat a patient, correct?
No, you're absolutely right. So whether you're taking any supplements, herbal medications, vitamins, you just want to make sure that your provider knows that, and then make sure that it's not interacting with any of your other prescription medications, or you may want to take them at different times in the day so that the absorption of those medications are not interfering with your prescription medications. My advice would be, number one, wherever you buy your herbal supplement CBD oil from, make sure that you talk with the person at the store that you're buying it from. Let them know what you're using it for, what is the dosage, and how should they take it, because your provider may not know specifically what brand, what prescription, what compounds are in that. So you want to make sure that not only do you talk to the person that you're buying it from and make sure that it's a reputable buyer and do some research on it, but you also want to let your provider know so that there is no interaction with your other medications. Patients, if they're going to try anything, whether it's over-the-counter or prescription, they really need to do some research on it as well to make sure, number one, is it something that they should be taking? Number two, can it interfere with their other medications? And number three, notifying their provider that they are taking that so that you can have an informed conversation between you and your provider to make sure that what it is that you're taking, whether it's over the counter or a prescription, is number one, benefiting you as a patient, hopefully treating those conditions that you want it to, and number three, that it doesn't cause any harmful side effects. So we, not only as a provider, but as a patient, we have to do our due diligence, make sure that you have open communication, and that you understand what it is that you're taking the medicine for, and you understand the side effects so that you can, again, make an informed decision with your provider.